invested all these resources.
These were done by, I think, the Dutch.
What is your plan for these asbestos?
Services to the maternities.
Onyonka mwenyewe.
We don't have a comprehensive main store. These are entries, these are some of the control drugs. When they order, we need evidence that they are finished so that we can.
Yeah, we are in the process of automating, but then we were told that
My advice.
Yes.
Unajua shida yetu serikali ni tunatakanga ni kama tuna invent the wheel. Tunaje.
Yes.
If you go to these private facilities, see their stocks are monitored from. Sasa wewe unaona wewe unaitisha empty bottle.
That is also a requirement even in the private. You have to have evidence that you finished for you to be replenished.
If you really, you have to be real time on checking the stocks. Don't you think it would be better to automate? And my advice is this. You know, ICT systems, you can, there are so many people who are vendors. Look at the private facilities, public facilities are working system. Just know where was the system from, how are the specs. Come and deploy the system on answer point. Alafu sasa hii tutaanza kufanya fiscal count. Sasa hapa tutafanya gani? Kuna gani?
Yes.
What was the name of your drug?
Kabetosi.
Nataka kuangalia hiyo ya kabetosi. Thank you very much, ladies and gentlemen. Today we are here as the Senate Health Committee in our county inspection visit to the county facilities. Our focus is on county referral facilities, but wherever we have opportunity, we also visit the level 4 and level 3. Today we have had a visit to the Nakuru PGH, as popularly referred to, and we have looked around at the services that are being rendered in this facility, and we have found areas that they are doing extremely very well, and there are other areas we shall be making recommendations for improvement of service. I wish to note that Nakuru level 6, or popularly referred as PGH, as an excellent oncology facility that is receiving patients from quite a number of counties, and we found that they have equipments that are working. The equipments that have been acquired through the support of the national government, through the National Equipment Service Program, and the machines are in working condition. 2, we've also visited the maternity facility here, a facility that has a very high volume of deliveries, an average of 1,000 deliveries in a month. But we have also noted that the mortality rate is below the national average. If you compare the statistics of the mothers we lose through the national statistics compared to them, they are doing very well. And this is also associated to innovations in terms of the drugs that are being used. There is a need for continued research, and this is where KEMRI and the National Teaching and Referral Facilities come in to continuously carry out research on how we can cap the mortality rates in our facilities, particularly our mothers who go to deliver. We have to make sure that we reduce the numbers that we lose, especially those mothers that we lose through what they call post-hemorrhage situations, a situation that can be prevented. That's actually excessive bleeding after delivery. Is a matter that can be handled if effort is put and the necessary drugs are also procured. Nakuru County Government has done very well in that area, and we want to commend them for that. We have noted that there is need for increase in human resource, and this is where sometimes people confuse and say counties have become employment bureaus. We should all know that more than 60% of county budgets on salaries is actually on medical personnel. And the reason is this: the specializations are so many, so you need every specialist for every area. We need enough nurses, we need enough clinical officers, we need pharmacists, we need doctors. But in advanced levels, you need a nurse for nephrology, for those who are doing dialysis. We need trained ICU nurses. We need nurses who handle cardiology. We need oncology nurses. And that is why the wage bill for health is always very high. In spite of that, we cannot efficiently deliver quality health care without human resources. So we are also asking the county government of Nakuru to put measures in place to ensure that we increase the number of staff that work in this facility, particularly now that SHA and F5, the F5 Act is in place and the facility is generating revenue and there are reimbursements from SHA. The information we have been given here is that on average in a month, this facility collects about 23 million and receives a reimbursement of an average of 60 million. That brings to about 83 million in a month. We are asking the management, and when we talk of management, now that we have F5 Act, we have a board of this facility. And we have the person in charge of this facility who is the secretary to the board. And they are the ones now make decisions on how the funds that have been received are going to be utilized. We are recommending to them to consider adding additional staff so that the casualty here, that we've seen a very serious shortage. We have 2 nurses serving about 1,000 patients in a day. We have 2 doctors who are supposed to serve that population both day and in the night. We have about 4 clinical officers. That ratio, a patient to a medical worker, is very high. So we are recommending that using the F5 funds, they don't have to go back to the county, to the main budget. Using their own generated revenue, they can now address those issues. We have also seen the issue of drugs. The facility is well stocked, but we are only asking them to improve on the management of their records. We have also noted that this facility has the debts to KEMSA for Nakuru County are about 78 million. 3 million is owed by the county headquarters as a pharmacy that serves the county, and the 75 are on facilities. We are also asking the hospital management boards in those facilities to prioritize paying their debts to KEMSA to ensure steady supply of drugs. So I don't want to say more than that, but we are going to do our detailed report as a Senate committee, share with the county government. There are things they can sort in the short term. There are things that requires budgetary provision and allocation. We are going to make all those recommendations. But we are happy that SHA is working. At least we have confirmed that it is not only one issue of the strikes. And I don't know why you want national government to address the strikes. One, we must appreciate that county governments are governments on their own, and they are independent entities, and they have county public service boards that are responsible for recruitment and promotion of staff. Every county and county governments sign what we call collective bargaining agreements. We only want to ask county governments to make sure that as they sign the collective bargaining agreements, they must also implement those collective bargaining agreements so that we avoid the issues of strikes. Secondly, let me say that the workload that is in our facilities is as a result of the shortage of the staff that we have. If you look at every facility in this country, public facilities, we still need more medical workers. We also want to encourage the unions to allow county governments and national governments to use innovations that can reduce the shortage, either by recruiting health workers as interns or on contract, but with a proper framework that will transition them finally to permanent and pensionable. It is not possible for a facility like this one to be able to recruit all the health workers they need. If we insist it must be on permanent and pensionables, then we expect that the shortage is going to continue. And we are asking the staff who are already in service that it is to your benefit. If today the county government of Nakuru recruits more staff for this facility, it is to the benefit of the current staff, because one, if there is shortage, it means that staff cannot go on leave, number one. If there is shortage, it means you cannot go on study leave. That hampers career progression. We want the staff also who have been employed to be able to progress their career, whether through study, through promotions, and so forth. That will only be made possible when we increase the number of staff. So we are asking the health workers, the unions, to work with their county governments and bring in innovative ways of making sure we reduce the shortage and have a proper legal framework that will then transition the workers who have been taken either as interns or casuals into a permanent and pensionable basis, as opposed to the current situation where you would find some health workers have either been working as casuals or interns, and when county governments advertise, they recruit people who are not working in those facilities. We must give priority. And this is why I want to congratulate the county government of Nakuru, because from 2016, 2018, those who are on contract and casuals, they have already been converted to permanent and pensionable, and they are working towards confirmation of those who have been taken thereafter, so that it now paves also room to take additional staff on contract. If we all agree to work that way, then we shall ease the shortage in all our public facilities. So the issue of automation, we have checked. National government is rolling out an HMI system that's already been rolled out in level 1, level 2, level 3. Work in progress is going on for level 5 and 6 facilities. So we expect that when the system is fully rolled out, then we shall have an integrated health management system that, one, will be able to provide data for the county to make decisions in terms of the investments they want to do. And even national government, they will be able to get data that will enable them make correct projections and budgetary provisions for specific treatments and even equipment requirement. What has been lacking for a very long time in the health sector is actually proper data and statistics that will enable the ministry to plan more efficiently. If you don't have data, you cannot provide enough. You can provide less or excess, and you don't know where to deploy your resources. This HMI system is actually going to help the ministry improve in their planning process, and even county governments in their planning process. Asanteni sana.
One of the things we found out last year is when we went to Kiambu County and we raised the issue about solarization. And Chair, I am very, very happy that the governor of Kiambu actually took it upon himself, and he has solarized each and every county building, whether it is a hospital, an ECD center, and everything. And I'm sure you saw last week when they made an announcement when they are seeking to become a city, that this financial year is actually saved 900 million shillings for installing solar power. So we are encouraging all the facilities that we have, especially this is a very, very big facility. So the officers have committed, and we are encouraging them to solarize. Number two, the other issue, because many of the issues I deal with are more to do with maintenance and management. You can see up here that there are certain sections, we have got asbestos, and we have told them that there is a government department under NEMA. They have already recruited about 15 companies that are going to remove these panels off our roofs. Our job as a Senate is to encourage and tell the government that they need to run as fast as possible, because asbestos is cancer causing, and yet it is being used in a hospital. You can see the contradiction of that. Number three, it is true that some of the health facilities don't have even enough beds. Why? Because you have got various problems which exist within our facilities. Like Chair has said, right now the FIF is working. Right now there are deductions coming from SHA, and the county government is also allocating money. We expect that as soon as they can, they continue and procure more beds, make sure that the women where they're sleeping, make sure that the children's wards are actually well equipped and facilitated, so that we can then sort out the problem that we have seen here. And many of you have raised these issues and we've talked to them. Finally, I want to say that we came here to see the team that is running this place. I believe that they are doing their best, but they need to do a much more better than what they have done. We have shown them some of their buildings are cracking. You have walls which are cracking. You have toilets that are not functional. In the next 1 month or so when we come back, we expect, because some of these facilities don't need a lot of money to fix. You remember we've been talking about it. It doesn't need a lot of money to clean a toilet. So these are the things that we are talking about. And personally, I am satisfied that Nakuru Referral is moving in the right direction. I believe, Chair, if we come back here in the next 1 month, we should see changes. And if we don't, then we'll again continue pushing so that we can provide the services that Kenyans need. I'm very happy that I came. And Chair, I think the team that is here, I congratulate you. You've done as good as I expected, but you can do better than you've done. Thank you so much.
Maybe the last question is, how free are these hospitals in terms of spending FIA?
No, there is a committee. The law we passed allows a committee of the hospital to access the money and utilize it. Next time when we come, we are going to sit down and look at the expenditure. We are going to look at the Auditor General's reports. We are actually going to look at the DNA and see whether the money that is supposed to be spent is being spent at the right places and for the right people. We are happy that medicines are available. We are happy that the postpartum problem where ladies bleed after they have given birth is now under control. We are very happy with that. And we believe that there's much more that can be done to just make sure that our people are given the basics. We don't want them to be given Nairobi Hospital, Lenana Hospital, or Aga Khan. Nakuru is as good as Aga Khan. It depends on the people who are here who can change, improve, and work on what they have. And I think they are moving on in the right direction. Thank you so much.
Okay, thank you. My name's Senator Chemitei. I'm the Senator Baringo, and this morning we've had a visit to this facility as a Senate Standing Committee, and several challenges that are faced by the facility have been addressed by our chairman. Maybe to say something about, one of you have mentioned about the bed sharing by the patients. So we've had a visit there, and according to the records, the facility is receiving about maximum 30 patients per day, and the beds that the capacity of the facility are 48. So I don't think whether there is bed sharing. So maybe I can only address about the volume, the number of patients that is being received by the facility. It is actually burdening the staff, and one of our recommendations as a committee, and we recommend the facility to add more staff so that they be able to discharge their duties on time. Thank you.
Of the Health Committee on the Senate, members of the Fourth Estate, and the guests who are here today, mine is only to appreciate the Senate in charge of health for coming to our county, and especially for visiting our PGH hospital. I want to appreciate you so much, and I want to assure you that your recommendation and your advice, we are going to take it very seriously. And we see you as friends, because you are not coming here for witch hunting, but to give us advice and to encourage us on the positive role we have just done. Otherwise, mine is only to welcome you and ask and say we really appreciate your coming, and you come again, because the more you come, the more we are going to improve in our facilities. Asanteni sana.
Thank you so much. Thank you.